Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're happy to have a special guest with us this week, Ed Dooling. He is the Chief Human Resources Officer for Masonicare. Welcome, Ed, and thanks for joining us again.
Thank you, Sandy.
It's a pleasure to have you today. We've heard a lot in the news about healthcare staffing shortages nationwide, and Connecticut is no exception to that. How is Masonicare responding to this?
Sure. Yeah. I think it's healthcare and even non-healthcare industries everyone is experiencing labor shortages these days. And I really first off wanted to thank our staff. We have a dedicated and talented staff across Masonicare, and what they've done the past 2 years, but really 2 years and before that has really been a testament to their dedication to our patients and our residents, and they've really gotten us through this. We are continuing to invest and develop in our staff through programs like tuition reimbursement. We've also invested in a number of staff who've gone through CNA training programs, and we've funded their tuition for that. I think on the other side of it, on the benefit side, we've been trying to offer a lot of programs, wellness programs through our EAP with our health insurance carrier, and to just give support to our staff because they really and truly have gotten us through this pandemic. On the other side, on the recruitment side, our recruitment staff and human resources is continuing to really work tirelessly to onboard new employees, recruit new employees, and get them up and running. So, I would tell you that we feel everyone's pain with our staffing shortage, and we are doing everything we can. But I just wanted to thank certainly the staff across Masonicare, as well as our human resources staff, who are really working tirelessly to get us through this.
Thank you so much, Ed, and we all really appreciate the efforts that your team are doing every day. And JP, echoing Ed's message, it just can't be said enough how grateful we all are to our team members for their dedication and their compassion during this pandemic and always.
Sandy, Ed hit it right on the head. Our staff have been truly amazing during this really unprecedented time of stress, uncertainty. Hard, dedicated workers that we have just done an absolutely amazing job, and I can't thank them enough. We actually have the state of Masonicare that we go around to all of our staff, and we're going around to all of our residents in our residential living side. And I can't tell you how proud I am of how our staff have been truly amazing during this time. And when we talk about the staffing shortages, it's not just in our industry. It's across really all industries. As an example, and Ed and his recruitment team have done an absolutely amazing job, but we've had to rely on other organizations to help us through the process: fingerprinting, criminal background checks, doing the physicals, things of that nature. Those are all being impacted not by us, but by shortages of other organizations that are doing it. And I think that's been extremely challenging also. But through all of that, I will tell you that we've been able to hire quite a few of our staff and have been able to keep up very well with recruitment, and also still delivering on our promise. And that is probably the most important thing for us is our mission is what we are truly all about. And our staff are the ones that deliver on that promise. So I echo Ed, great job. They are doing a fantastic job. We're not done with this. We've still got a lot more to do, but we are moving forward in the right direction. We also have started doing the boosters for our staff and our residents. So we're excited to be able to do that. And I will tell you that our staff are stepping up again. They are looking to get that booster. They are understanding that that booster is another step in that normalcy that we're all looking for. And I'm happy that I'm seeing that along our staff and our residents. So if you take anything out of this video, it's a thank you, it's a thank you, it's a thank you. As Dr. Schwartz has in the backdrop, our flag that we display so proudly of thank you to our staff. Thank you for all that they do.
Absolutely, JP. Thank you so much. We have true healthcare heroes at Masonicare, that's for sure. And Dr. Schwartz, turning to that medical news about the COVID-19 booster shots, those who are eligible have begun to get them, and the CDC is tracking the potential side effects of the vaccine so far. What is the early data indicating?
That's a good question, Sandy. And I guess booster shots are a hot topic for COVID once again. And I'm happy to say I did get a booster shot, and I did get my flu shot as well. And I'm still here to talk today, so that's good. So I have a nice article that kind of summarizes what you asked about side effects. And again, articles are usually 4 or 5 pages long. I try to condense it again to 1 page to try to just give you the highlights, and I'll read most of this to you. So the title of this article says, Side Effect Rates from a Third COVID-19 Vaccine Dose Similar to Those After Second Shot, Early Data Indicate. So it goes on to say that people who've received a third dose of a COVID-19 vaccine are reporting rates of side effects similar to those after the second dose. And this is according to data released by the Centers for Disease Control and Prevention. And the new report that was published in Morbidity and Mortality Weekly Report relies on submissions from thousands of people who received third shots of mRNA vaccines from Pfizer and Moderna after such doses were authorized for people with compromised immune systems. So it's interesting, people submitted their reactions to vSafe. It's the CDC's smartphone-based surveillance network. And they had more than 12,500 people who completed surveys after each shot. And I'm just going to give you some statistics now, just so you can see comparison. So they said 79.4% of people reported local reactions, itching, pain, redness at the injection site, while 74.1% reported systemic reactions, mostly fatigue, muscle aches, and headaches, typically the day after the shot. Now they compare this to 77.6% and 76.5% of people who reported local or systemic reactions, respectively, after their second shot. So you can see it's almost the same type of statistics. And what they say now is the new data provide at least an early hint that in terms of immediate reactions, it doesn't seem as if third shots caused more of a kick than the second shots did. And this is important as they're gathering data and the government's trying to decide to authorize boosters for a wider group of populations. So this is a quote from the authors of this report, and they said, these initial findings indicate no unexpected patterns of adverse reactions after an additional COVID dose of COVID-19 vaccines. Most of these adverse reactions were mild or moderate. And again, they say overall, the COVID-19 vaccines have proven to be remarkably safe as well as effective, and generally experts don't anticipate a significant increase in the likelihood of most side effects with booster shots. So that's good news. And the only other thing just to bring up, they say there is some concern in particular with third doses of the mRNA vaccines, you know, the Moderna and Pfizer, with what we talked about before, myocarditis and pericarditis, which we talked about earlier. These are two types of heart inflammations that have appeared highest among young men and boys as soon after the second shot. So there is a worry or concern that a third shot could carry even a higher risk. Though for now, it's just a concern for that population. And they say in general, this population remains very well protected by 2 doses of the vaccine. So it's led to a debate about whether third shots will be justified at some point for young men and boys broadly. So you see, there's a lot of topic and a lot of things to continue to look at and discuss. And again, we talked last time about why there's not a blanket recommendation for for everybody to get the booster shot, but it's being looked at very carefully and very closely. And I think that can give us some assurance. So as I turn now to my weekly inspirational quote, or every other week inspirational quote, this comes again from the Masonicare Charity Foundation calendar. And it says, "Laughter is to life what shock absorbers are to automobiles. It won't take the potholes out of the road, but it sure makes the ride smoother." And that was said by Barbara Johnson, and she happens to be an award-winning author and Women of Faith speaker emeritus. So I guess in my closing, I just want to echo JP and Ed's sentiments about, just how great the staff has been, how hardworking, how dedicated, and just thank everybody for everything that you do and working together. And again, I wish you health and I wish you peace. Thank you.
And we thank you once again, Dr. Schwartz. You always give us a much smoother ride. Thank you all so much for sharing your time and your insights with us today. And we thank you for joining us at home once again. Until we see you next time, we hope you'll stay safe and stay well.